Hello and welcome. My name is Dr. Saurabh Talekar and I'm an orthopedic surgeon, the founder and director of Holistic Care. This is not one of my usual videos, and usually my videos are made for my patients. This is not one of them. This video is made on a special request from a teacher from Shriram Welfare High School Society, Andheri, Mumbai, by Saurabh Talekar, teacher, who is my mom. So today we'll learn how to do a Suryanamaskara on how I feel is right as a musculoskeletal surgeon. There are certain people who perform it in a way which can cause injury. So this is my way of doing it. I've learned it from a couple of friends, tweaking the real Suryanamaskara in a way how you can avoid injury. Okay, let's go. So very important is to start in a position which is called the Samasthiti. So what is the Samasthiti? This is the position where you cause minimum injury to all of the joints of the body, and this was taught by our ancestors. So you make sure that your feet are grounded, equidistant, shoulder width. Make sure your knees are slightly bent. Make sure your patella, that is your kneecap, is pulled towards yourself by contracting these muscles, which are the quads. This, you should understand what is a posterior and anterior tilt. So when you keep your hand on your hips, when you tilt it forward, you arch your back. When your back is arched, this is called an anterior tilt. And this, when the back is round, this is a postural error what people have when they have like long sitting jobs. This is called the posterior tilt. The pelvis is tilted posteriorly, and this is your normal tilt. So make sure that you are in a normal tilt. So your feet are grounded, your knees are slightly bent, your patella are pulled towards your body, towards upwards. Your pelvic tilt is normal, your abdominal muscles, your core is tight, your shoulders are pulled down and not shrugged up like this. Your back is erect and your hands are activated. Your chin is tucked behind. So this is a position which is an accurate, correct posture. This is where you start. This is called Samasthiti. I usually like starting at the top of my mat in the Samasthiti. This is the first position, the Namaste Mudra. And when you raise your arms, make sure you do not hyperextend your neck, and you feel some tension in your upper back because of this extension. Slowly, without arching your back, try to go down and your pelvis remains stable. You're not bending from your back. Your back remains stable, straight, and you're bending from your hips. If you can see, I have not emphasized on touching my toes, because if I go down, I will be bending my back and I'm injuring my back. And our main aim is to avoid injury. So I be here. There's another variant what you can do here. If you want to touch your back, just go and touch your bend your knees a little bit. But I like to do it in this way. Make sure your shoulders are nicely rested. Next position. This is my modification to it, because if you're not used to doing Suryanamaskara, you will tend to bend your back, which is not so healthy for it. Next position is your plank. Very important is whenever you're using your palms, see that your fingers are nicely activated and all of the pressure, all of your weight is not coming only on your wrists. So all of the fingers are nicely grounded. So all the pressure getting divided. Can you go down? The next position is the upward facing dog. You can feel a nice stretch in your abdominal muscles. Make sure that your shoulders are not shrugged and they're nicely grounded. The next position is the downward facing dog. Listen to your body. Do not overstretch. Your sternum should be directed towards the wall which you're facing, like towards your back. And you try to arch your back as much as you can, and you can feel a stretch in your hamstrings. Bend your knees as much as you can. Try to make them as straight as you can, but make sure that you don't injure yourself. Do not overstretch. Next position, or the alternative. And slowly come back up. So this is my way of doing it. I've learned it from different places, made some small tweaks in the technique. I think when you do it this way, even 12 a day is enough. Please share any comments in the comment section if you feel you need to have a better way of doing it. If you have a better way of doing it, thank you very much. Namaste.